Hi, my name is Assalamualaikum everyone. This is Hamza Hussain and welcome to Pakistan Cardiac Super League Season 2 presented by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today we are live for the third match from the Super 6 stages. We have with us the two phenomenal teams, MIC Panthers, who we have seen a very phenomenal journey throughout this league, especially from their captain, who have played phenomenally well and cruised his team towards victory. But today MIC Panthers are up against the best in the business, the stars of the cardiology, AQH stars, and we are very excited that today's battle will be a very nail-biting and will be a very decisive battle as well, because if MIC Panthers win this match, they will straight qualify for the finals, and AQH will have to walk away from this competition. And if AQH wins, they have to win the next match as well to qualify for the final seat in the cardio cone. And with this, allow me to introduce the senior faculty members. We have with us the great Professor Ishaq Saab. He will be the umpire of today's match. And from the guest panelists, we have with us Professor Amber Ashraf Sahiba. Professor Amber Ashraf is Professor of Cardiology and Head of Department at 𝐻 Teaching Hospital, Peshawar. And last but not the least, moderator of today's match is none other than Dr. Hamza Ghori. Dr. Hamza Ghori is serving as Assistant Professor of Cardiology at RSC Rawalpindi, and I will now hand over the mic towards Dr. Hamza Ghori to start the proceeding of today's match.
Thank you very much, Hamza. So we are back again for the second season of Pakistan Cardiac Super League, which is obviously happening in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. As we all know, we are now into the Super 6 stage. We've already had two matches, two very tight matches. And this one is the third match. And as Hamza has put it very rightly, two phenomenal teams are head to head today. So we have Multan Institute of Cardiology Panthers versus Aga Khan University Hospital Stars. So let's see how it goes, and we are all geared up for a wonderful match once again. And with this, I now move towards our highly esteemed panel members. Of course, the umpire who has been extremely instrumental, the life of the show, it is Professor Ishaq Saab. Welcome, sir. And it's also great to have Professor Amber Ashraf, who's there as one of the panelists and experts with us. So, ma'am, it's great to have you, and we will have more introductions coming our way as we have more panelists joining us. And now...
Thank you, sir.
Thank you, ma'am. It's great to have you. So, I'm now going to move towards the two teams, and the two captains will give the introductions. So we will start with Aga Khan University Hospital Stars. Captain, introductions please.
Assalamualaikum. I'm Dr. Rizwan Ali Khwaja, currently a Year 3 Cardiology resident. With me I have Dr. Akil, who is also our senior resident Year 3, and we have Dr. Anna with us.
Welcome to the show and best of luck for the game today. Now,
thank you.
We have MIC Panthers. Introductions, please.
Hello, our captain is running late due to traffic situation. So I'm Dr. Adnan, and with me is Dr. Sadia, and on my extreme right is Dr. Aslan, third year resident. Our captain has just arrived.
All right. So it's great to have the captain taking his seat, and I wish you all the very best for this match, as both the teams have to fight it out and they are all fighting for a lot. MIC gets through, Aga Khan stays, and then obviously they'll have to win the next one too. So I'm now going to move towards the all-important coin toss. So can we have the electronic coin on the screen? I'm randomly going to ask one of the teams to call it either heads or tails. So, Aga Khan University Hospital Stars, heads or tails?
Heads. It's heads.
So they have called heads. Roll the coin, please. And it's tails. All right, so we do have a winner. MIC Panthers, luck seems to be on your side today. Let's see how it goes. So, can we have MIC Panthers on the screen? I'm going to pose you with two questions, as we all know. The first question, you want to take the questions or you want to throw the questions?
We want to throw the questions.
All right, they want to throw the questions. And the second question is, would you select case A or you want to go with case B?
Oh, case A.
All right then. So they have selected case A, and the news from the center is MIC Panthers have won the toss. They want to throw the questions and it's going to be case A. All right. So are we ready? Yes, we are. Can we have case A on the screen, please? And I'll request Panthers to read it.
A 65-year-old man is evaluated for bilateral calf pain on walking 50 yards that resolves if he stops to rest. He has a past history of diabetes mellitus, dyslipidemia, and a current 50-pack-year history of smoking. He takes no medication. Physical examination reveals a BP of 140 by 80 millimeters of mercury and a heart rate of 70 beats per minute. Lower extremities are warm and pink. There is no evidence of hair loss or nail changes. Pulses are faintly palpable and are monophasic by Doppler evaluation. The ankle brachial index is 1.1 and 1.0 on the left and right respectively.
All right, so stars, I'm going to give you a couple of seconds to gather yourselves, and then we'll start with the first question.
1.1 और 1.0 में तो 0.90 तो 1.2 होता है ना तो बीच में अब सारे सवाल आ जाएंगे उससे रिलेटेड सही है.
All right, stars, are you ready?
Yes sir.
Let's have the first question on the screen, please. Read it.
Hamza, kindly share the screen. I can't see the screen.
There's a technical issue over here.
Okay, so I think we don't have MIC. Are you there? Because we can't see you.
Yes, sir, we are here. And which of the following is the next best step in this patient?
Okay, so I think just hold for a second. Do we have MIC? Because we can't see the screen. We can't see them on the screen. And Ishaq Saab is also unable to have the screen there. Okay, so I've just been told that there is a technical issue and they are trying to fix it. So we'll continue with the question. Please read the question.
Which of the following is the next best step in this patient? A. Exercise ankle brachial index testing. B. No further testing required. C. Duplex ultrasound of the legs. D. Lower extremity angiography. E. Toe brachial index testing.
And your 60 seconds start now.
Okay, so we would like to go with option A, exercise ankle brachial index testing.
Are you sure?
Yeah, we would like to go with it.
Okay, so they have come down the wicket. They want to hit it for a 6. All right. They want to lock option A alpha. All right. Lock A alpha. Yes. Surely that's a 6. That's what we were hoping for. And very well done. Very well played. A great start. All right. Question number 2 on your screen.
All of the following parameters are suggestive of a positive post-exercise ABI test except A. Post-exercise ABI less than 0.9, B. Decrement of more than 20% in ABI value, C. Absolute decrease more than 30 mm in 30 mm of mercury in ankle pressure, D. Delta from resting oxygen pressure value less than 20 mm He, E. None of the above.
And timer starts now.
सॉरी तुम क्या कह रहे हो सारी और मुझे एक्सेप्ट कौन सा नहीं है तो देखो कौन सा लगा मुझे ई ऑप्शन लगा रेस्ट प्रेशर लिमिट लेस देन 20 जिसका नहीं नॉट श्योर अबाउट नॉट वो ठीक है डिक्रीमेंट से मैं जाता हूँ 20% से ज़्यादा डिक्रीमेंट है तो मतलब नीचे जा रहा है कुछ एक्सरसाइज कम हो तो मैं समझ आता है एब्सोल्यूट डिक्रीज मोर देन इट मेक सेंस टू गेट डेल्टा फ्रॉम रेस्टिंग हो सकता है sure we'll go with E. Yes, let's go with it. Okay, so we are going with option E, none of the above.
Okay, you want me to lock E epsilon, option E, right?
Yes.
Okay, lock option E. Oh! Well, that's the first miss here, and yeah, you just whiskered past your outside edge, I would say. But never mind, you still have 8 more questions to go. You need to be a bit more careful with these. Can we have question 3 on the screen?
Following are the readings of blood pressure from patient during exercise ABI. Right arm BP 120 by 80, left arm BP 125 by 83. Right leg dorsalis pedis BP 100 by 75, right leg posterior tibial BP 95 by 72. Left leg dorsalis pedis BP 105 by 70, left leg posterior tibial BP 100 by 75. What is the ABI of this patient now? A 0.6 for right leg and 0.67 for left leg. B 0.8 for right leg, 0.84 for the left leg. C 0.72 for right leg, 0.8 for left leg. D 0.55 for right leg and 0.60 for left leg. E 0.85 for right leg, 0.92 for left leg.
And the timer starts now.
Difference in 125, 95. क्या difference are divided by 120 ABI निकालना है 125 माइनस कर रहे हैं हम सिस्टमैटिक ब्लड प्रेशर 95 से डिवाइड 25 so divide by 95 से आएगा स्लैश बिल्कुल ठीक तो मेरे ख्याल
So I'd like to welcome 𝐴𝐵𝐷 Siddiqui Saab. He's there as the second umpire, so great to have you.
D और दोनों significant D
Come on, 10 seconds now. Hurry up. We need an answer. Come on, 7, 6.
Option A. We would like to go with option A.
Okay, so they want to go with option A. This was a difficult one, a quicker delivery. Let's see how they have done. Option A, lock A. Oh. So it's a miss here. Well. So we're now going to the next question, which is question number 4.
What is the recommended frequency of ABI measurements in patients with peripheral arterial disease? A every 3 months, B every 6 months, C every 12 months, D only at diagnosis, E only with change in symptoms.
And 60 seconds on your screen.
अगर 3 minutes को evaluate करना चाहते हो in the patients with PAD अगर उसको है तो known है तो 3 months, 6 months, 12 months only at diagnosis. 3 months only with symptoms.
Come on, stars.
E या B में से कोई कह रही है कि symptom change but 6 months करें बाकी योर को मतलब
Approaching 20 seconds.
लेकिन साइलेंट भी होगा तो डायबिटिक्स में डिपेंड करता है ना रूटीन
B
10 seconds. Come on.
So we would like to go with option B, every 6 months.
Option B, beta. They want to go with option B. Right. Lock option B. Oh, another miss. 3 on a trot. Come on, stars, what's going on? Well. It's a crucial game. All right then. So moving to question number 5. Read it, please.
In which class does this patient fall according to Fontaine classification of chronic limb ischemia? A class 1, B class 2A, C class 2B, D class 3, E class 4.
60 seconds on your screen.
And exercise that
लेकिन इसका एरिया था ना वो इंस्ट्रूमेंट
इतना ज्यादा है।
सो let's do it
नहीं वैसे कोई मैं सारे का पूछ लेते हैं। We don't know. उन्होंने 3 मार्क करना है, 4 मार्क। क्या करेंगे तो है we would like to go with option B, class 2A.
Okay, so they want to go with option B, beta, class 2A. Lock option B. Oh no. All right, so that's 4 misses in a row. We really need a reasonable total. Come on, stars, you need to pick up the pace. All right, moving to question number 6 now. On your screen.
All of the following should be considered in this patient as class 1 indications for MACE reduction except A. Tobacco cessation therapy, B. High dose statins, C. Anticoagulation, D. Single antiplatelet agent, E. Good glycemic control.
60 seconds, start now.
Tobacco, high dose statin, and antiplatelet make good glycemic because patient is diabetic, anticoagulation. ऑप्शन के इमेज में क्या फायदा we would go with option C.
Okay, they want to go with option C, Charlie. They came down the wicket, they wanted to smash it straight away, but then became a bit careful. Let's see whether they've gone with the right option. Option C, Charlie, lock it. Yes, your instincts were right. Well played. Well done. Good answer. With this, we move to question number 7.
The HbA1c of this patient came out to be 8.6%. Which of the following should be avoided in this patient? A. Liraglutide, B. Metformin, C. Empagliflozin, D. Sitagliptin, E. Canagliflozin.
60 seconds on your screen.
तो हम क्या करेंगे कहना डापा कहना एक कैटेगरी के दोनों तो यहाँ से सीटा प्लेटफॉर्म में से सीटा
एक तो मैंने जीप वाली चीजें और एक फॉर्मूला मुझे बताया कि लैक्टिक एसिड दैट कुड बी समथिंग एल्स आपकी वो खुली है तो इन द लॉन्ग टर्म अगर आपको उसको करना है अदरवाइज और
सीटा कौन सी कैटेगरी
जी ये वो है ना ऑर्गेनो पपार
जैसे कोई होगा फिर मैं फोन सीट
Approaching 20 seconds.
मुझे पता है कि लॉजिक कर लगा तो
10 seconds, come on. Stars. Is this a googly?
Okay, so we would like to go with option D, sitagliptin.
Okay, very carefully they have gone with option D, delta, sitagliptin. So lock option D, please. Yes, definitely turned the other way. And we have another miss, which is question number 7. So you can still put up a reasonable total. Keep your spirits up. You have 3 more questions to go. Play it wisely. Can we have question 8 on the screen, please? Go ahead.
You started the patient on guideline-directed medical therapy, including clopidogrel 75 mg, atorvastatin 80 mg, and sitagliptin 50 by glucophage 500 mg. 4 months later, the patient presents with 5 days of right foot pain. On examination, his blood pressure is 162 by 97 millimeters of mercury, heart rate is 88 beats per minute, heart sounds are regular but distant, and lung sounds are diminished. His right foot is cool and dorsalis pedis and posterior tibialis pulses are non-palpable. Which of the following findings would prompt emergent revascularization within 6 hours? A. Audible arterial Doppler, audible venous Doppler, no sensory loss, no muscle weakness. B. Inaudible arterial Doppler, inaudible venous Doppler, sensory loss in foot, no motor function. C. Inaudible arterial Doppler, inaudible venous Doppler, no sensory loss in foot, no muscle weakness. D. Audible arterial Doppler, inaudible venous Doppler, no sensory loss, no muscle weakness. E. Inaudible arterial Doppler, audible venous Doppler, sensory loss to midfoot, mild muscle weakness.
60 seconds on your screen.
Audible venous Doppler, sensory loss in midfoot and mid muscle weakness.
बाकी का देख ले तो ऐसा होता नहीं है।
अभी B और C
हाँ,
B और उसमें
audible
inaudible
arterial तो नहीं होएगा।
B
Inaudible.
और C के ना दोनों में inaudible arterial pulse, inaudible venous pulses, sensory loss, no motor function loss. ऊपर motor function था। हाँ ठीक है। No sensory loss and C तो कट गया। B और B में sensory loss है, no motor function. उसमें कह रहा motor function
नहीं, उसमें कह रहा है no motor function।
25 seconds.
फंक्शन पता ही नहीं है, salvageable नहीं है।
तो E मसल
C में ये है कि no muscle weakness लेकिन inaudible venous है। तो वो आपके पास already
15 seconds.
E।
We would
Come
go
on.
with option E. Option E, inaudible.
Okay, they want to go with option E, epsilon. So lock it. Yes, that's very well done. The discussion was spot on. You deciphered it well. Great job. Very well done. I think this should give you a lot of confidence for the next 2 questions. With this, we move to the second last question of the innings. Question number 9.
Given the information inaudible arterial Doppler, audible venous Doppler, and sensory loss to midfoot, mild muscle weakness, how would you classify this patient according to Rutherford classification of acute limb ischemia? A class 1, B class 2A, C class 2B, D class 3, E class 4.
And the timer starts now.
आप लोग कह रहे हैं कि inaudible arterial pulse, audible venous pulse, sensory loss in midfoot, mild muscle weakness. So now we know कि काफी चीजें खराब हो गई। 2B 2A से आगे निकल गए। 3 और
4 नहीं हो सकता
4 भी आगे नहीं, salvageable
muscle weakness
I guess 3 फिर बचता है।
3 और 2 भी
2 भी तो नहीं लगता।
समझ गए।
It's confusing. We would like to go with option D, class 3.
Okay, so you want to go with option D, delta, right? Okay, they've swept it hard. Let's see whether it's going for a 6 or not. Option D, delta, lock it. Oh no, it's not. Well.
Yeah.
That's another miss. And your score is 18. And we have one more question to go, which is the last one for this innings. Question number 10 on your screen, please.
Which of the following is an emerging biomarker for peripheral arterial disease diagnosis? A. HSC reactive protein, B. fibrinogen, C. beta-2m, D. trimethylamine N oxide, E. cystatin C.
And the timer is on your screen. 60 seconds.
Known inflammatory marker of a point is facing emerging biomarker.
So that's an in-swinging Yorker.
D. D. Try matrix. Sure. Emerging. तो मैं एक जाना है।
D में से कोई है।
Yeah, I'm not sure.
20 seconds. They are not sure, I guess.
डी करना था
15 seconds.
Yeah. So we would like to go with option D.
Option D.
Option D.
Are you sure? Okay,
Yes.
sure or not, but I think they've gone with option D now. D delta. It's a pedal sweep. Let's see what happens. Option D, lock it, please. Oh, wow! That one worked for you. It's gone for a 6 over third man, I would say. Well done. Very well done. And that's a very good end. But I think now we have a total of 24. And this is where we are. The first inning has ended. And Aga Khan University Hospital Stars, they've actually put up a score of 24, which is a low score, to be honest, in terms of what we have seen in the show so far. But I think they can still put up a good fight, and you never know what happens in the end. So let's see how it goes. And with this, I think I now have the opportunity to take some comments from our worthy panel members. And first of all, it's our umpire, Professor Ishaq Saab. Sir, your thoughts?
Thank you, Hamza. I think I was not expecting that they will have such a low score. Actually, peripheral arterial disease is somewhat neglected part of our education in cardiology these days. We are focused so much on the coronaries that we forget that there is a lot of peripheral arterial disease. And today's question and answers have revealed this fact that our students and trainees are more focused on the coronaries than on other arteries in the body, which are equally affected by atherosclerosis and other diseases. Well, they've tried their best, but they could have done better. 24 is not a big score, but let's see how the other team performs. You see, it all depends upon the other team as well. So, well, nobody should get discouraged or disappointed. This is a learning procedure. This is a learning exercise, and you always keep on learning from your mistakes, and you end up reading more and more about these illnesses and update yourself with latest guidelines. So I think my advice to the AKU team would be not to be discouraged. Keep up with your morale and give some more attention to non-coronary cardiac issues, including the peripheral arterial disease. With this, I would like to see how the other team does. And thank you, Hamza, for your excellent moderation, which is really gives life to this whole show. So thank you very much.
Thank you very much, sir.
Me and Professor Hamid Siddiqui, we are the two umpires who have always been there right from the beginning. And I think it's since I've been here for some time in UK, it coincides with my breakfast on weekend, and I really enjoy it. Thank you.
Thank you very much, sir, for your very kind words. I think you both have been the pillars for us in this show, and this was not possible without the support of our umpires, and obviously Dr. Ishaq Saab being the one umpire on one side, and Professor Abdul Hamid Siddiqui Saab, the other umpire that we've had so consistently with us. And yes, your comments are very true. It's a learning process. It's learning for everyone, and we are always striving for improvement. Peripheral arterial disease, this is one area where we do not put so much of focus, but I think we do get to see all these patients in our clinics, and all those institutes who are actually performing peripheral arterial interventions, they know how significant this problem is. And with this, I'll request our other star, that's our other umpire, that's Professor Abdul Hamid Siddiqui. Sir, your thoughts? Siddiqui Saab there? Okay, so we are extremely honored to also have our extremely highly esteemed panel member. We have Professor Amber Ashraf today. Ma'am, are you there?
Ji, Hans, I'm around. Thank you very much. That's a wonderful effort of the Wilson, and almost we have gone through so many of these series. It's a very wonderful learning experience, not only for the PGs, but for the faculty as well. And I endorse what Professor Isaaq Saab has highlighted, and that what it is very important in cardiology FCPS exams, all the PGs, they are now focusing on coronary artery disease, and they forget about what is heart failure, peripheral arterial diseases, then the pregnancy related, and there are so many other important topics which we all come across every day. So AKU team played very well, but the take-home message for all the PGs from this platform is, please do consider whole of the cardiology so that we have a good know-how about it. Thank you very much. Hopefully, these programs and activities will enhance that spirit more in our upcoming cardiologists so that they start learning all these things. But anyhow, let's see how MIC is going to play. And really, जैसे सर ने कहा ना, आपकी वजह से इस पूरे प्रोग्राम में जान है, इसमें कोई शक नहीं है. Thank you very much.
बहुत शुक्रिया मैम, हम कोशिश कर रहे हैं and I am trying my best. आप लोगों की support है and I think it's the team effort which is there and it's been a wonderful show for everyone, I do admit. So I think on our way, we have lost Abdul Hamid Siddiqui Saab. Hopefully we'll have him back. And with this, I think we'll now move to the second half and let's have scenario B on the screen. And I'm going to request the stars to read the scenario.
Okay, so a case scenario is a 48-year-old lady, diabetic hypertensive lady, known case of breast cancer due to receive trastuzumab based chemotherapy is referred to your cardiology clinic for cardiovascular risk assessment. On examination, she has heart rate of 90 beats per minute, blood pressure of 140 by 80 millimeter of mercury. Her chest and cardiovascular examination is unremarkable. She denies of dyspnea, however complains of mild chest tightness while going up to the second flight of stairs in her house. Her lab shows hemoglobin of 10.2 and pro-BNP was 150. Her troponins are 15. The ECG shows sinus rhythm.
Okay, Panthers. So you have a couple of seconds to organize yourself and then we'll start with question number 1.
अच्छा, और ये ट्रांसटोजमाब ले रही है पेशेंट ले.
Okay, so
क्या था?
Can we have question number 1 on the screen? Hold on, MIC Panthers. Let them read the question first. Please read the question. Stars.
What is the next preferred investigation for assessment of LVEF?
Options?
Option A, 2D echo. Option B, cardiac MRI. Option C, 3D echo. Option D, MUGA scan. Option E, none of the above.
And now you have 60 seconds, MIC
वो पीछे
Panthers.
सिनेरियो देखें कि ट्रांसटोजमाब मिल गई थी या नहीं मिली थी, कंफर्म. सबसे बेस्ट जो है ना वो मुगा स्कैन है मेरे ख्याल में. वो न्यूक्लियर स्कैन ही होता है ना, मुगा स्कैन हम जो करते हैं. तो प्रेफर्ड हमारे पास जो रेडियोलॉजी में है, ऑन्कोलॉजी में, वो मुगा स्कैन होना चाहिए. 3D एको कार्डिक. हाँ, प्रेफर्ड एक रेडियो न्यूक्लाइड जो होती है ना, जो वो हमारी जो एलवी फंक्शन असेसमेंट होती है वो प्रेफर्ड होती है. 2D एको नहीं होती. कार्डिक एमआरआई बहुत एडवांस जाके करती है, वो होती बेस्ट है. 3D एको है या मुगा स्कैन है. मुगा स्कैन, आई वुड लाइक मुगा स्कैन. तुम लोग किसी और पे बहते हो?
Approaching 20 seconds now.
Option D, Muga scan.
Are you sure? Delta, D, Muga scan. Captain.
Next preferred, yes, Muga scan.
Okay, the captain is now pretty sure. He wants D delta. All right, lock D delta. Oh, that's a miss. That's a miss.
Breast investigation bogus scan है.
Okay, very dynamic approach, very vocal. I think we all enjoy them when they are around, and the captain leading the way. Now, best of luck for the second question. Question number 2.
Echocardiography shows an EF of 50% by Simpson's biplane method. Based on the data available, how would you classify the chemotherapy-related cardiac dysfunction? A. No cardiac dysfunction. B. Mild cardiac dysfunction. C. Moderate cardiac dysfunction. D. Severe cardiac dysfunction. E. At risk of cardiac dysfunction.
And 60 seconds on your screen.
अब देखो पिछले सिनेरियो का हमें देखना. Can सिनेरियो देख लेते हैं जल्दी से. Can we have the scenario?
Yes,
please?
yes, show them the scenario.
लोगों के तो ब्रेस्ट कैंसर है, अभी ली नहीं है. पहले क्या था उसका सिर्फ और सिर्फ वो है. एट रिस्क है ना, डायबिटिक है ना, ये हाइपरटेंसिव भी है, फीमेल भी है. और ठीक है सर. सर क्वेश्चन प्लीज. नो कार्डिक डिसफंक्शन तो हम कहते हैं एट रिस्क ऑफ कार्डिक डिसफंक्शन ये 50% ये है. माइल्ड, अब माइल्ड लेस देन प्रिजर्व्ड है ना ये. बताएं. एट रिस्क ऑफ का ना रिलेटेड तो नहीं है ना. नहीं कीमोथेरेपी रिलेटेड नहीं है ना. कौन अब तो 10%. एट रिस्क ऑफ कार्डियक डिसफंक्शन करें. माइल्ड या एट रिस्क ऑफ. एट रिस्क कर देते हैं बस.
10 seconds.
एट रिस्क ऑफ कार्डियक डिसफंक्शन, ई ऑप्शन.
Okay, so very carefully they've gone with option E, epsilon. All right, lock E, epsilon. Oh, somebody was saying mild. Just missed it. Okay, so similar kind of a start. 2 misses. Let's see what happens on the third one. Question number 3. Read, please.
Oh my God.
Read question 3.
जी. So question number 3, HFA-ICOS risk assessment tool is used to assess risk of chemotherapy related cardiac dysfunction. Which of the following parameters is considered very high risk? A. Prior trastuzumab cardiotoxicity. B. History of MI. C. History of cabbage. D. Baseline LVEF less than 50%. E. History of severe valvular disease.
And the timer starts now.
HFA-ICOS risk हमने नहीं पढ़ा. Prior trastuzumab therapy, history of MI, cabbage, LVF less than 50%, history of the severe valvular. B और D, A नहीं होना चाहिए. सारे एक ही हैं. Structural heart disease सारों में है. MI भी है, cabbage भी हुआ है उसको. 50% से EF कम हुई है. History of severe valvular. देखिए हम डेफिनेट चीज़ है, हमने HFA-ICOS रिस्क नहीं पढ़ा हुआ, तो उसमें हमें ये है कि स्ट्रक्चरल हार्ट डिजीज हमें सारी लग रही हैं जिसमें हमें प्रायर ट्रांसट्यूमब कार्डियोटॉक्सिसिटी पहले से हुई भी है उसको वो, तो दोबारा ट्रांसट्यूमब लगेंगे तो वो ज़्यादा हाई रिस्क होगा. पहले एक तरीके से मायोकार्डियल डिसफंक्शन तो उसको हुआ है ना उससे, तो हमें प्रायर ट्रांसट्यूमब बस ये थिंग इसके हमें HFA-ICOS रिस्क नहीं है. आइडिया
15 seconds.
अल्फा डेल्टा बेसलाइन एलवी फंक्शन को नहीं, वो पहले कार्डियोटॉक्सिसिटी करा चुकी है. ऑप्शन अल्फा प्रायर ट्रांसट्यूमब कार्डियोटॉक्सिसिटी.
Okay, so they want us to lock option alpha. They are not sure about it.
Okay.
And it's a big swing. Let's see whether this one takes the ball out of the park. Lock option A, alpha. And yes, what a swing it is. Wow. You didn't know, but even then you scored, and that's your announcement. And you are now on the board with the first 6. Well played, very well done. Thoroughly enjoyed. Now, question number 4. Read the question. Stars.
Based on data given, what is the patient's HFA-ICOS cardiovascular risk? A. Low risk. B. Moderate risk. C. High risk. D. Very high risk. E. No risk.
And the timer starts now. 60 seconds.
Hypertension.
डायबिटीज से हाइपरटेंशन था और बाकी कोई इसका ब्रेस्ट कैंसर की वो तो ट्रांसफ्यूजन उसका ड्यू है. लो रिस्क है, ये नो रिस्क है. ये 50% नहीं, वो उन्होंने बाद में हमें क्वेश्चन पुट किया था. ये 50% पहले नहीं मेंशन हुई. नहीं ये 50% उन्होंने हमें एग्जाम्पशन दी थी क्वेश्चन पे. लो रिस्क या हाई नो रिस्क.
लो या मॉडरेट
ये भी लो या मॉडरेट. अब अभी देखें, अब डिसाइड करना रिस्क फैक्टर्स हैं उसके अलावा 50% EF के डॉक्यूमेंट पहले सिनेरियो में तो नहीं थी ना. बताएं, जल्दी बताएं, यहाँ बताएं. लो रिस्क में लो रिस्क लो रिस्क आई वुड से लो रिस्क.
15 seconds.
lower option alpha
10
कर रहा हूँ
seconds
मैं
now.
option alpha low risk
Okay, so they want to go with alpha. Option A, alpha, low risk. Lock A, please. Oh, no, no, no. That's the wrong answer. You were totally thinking in the wrong direction. It was high risk. All right, all right. So, we've had 4 questions so far. We have 1 right answer. Score is 6. I believe stars were also in the same situation after 4 questions. So the graph is equal after 4 questions. It's getting tighter. Are we going to have a nail biter? Let's see. Question number 5 on your
इनसे
screen.
पूछ लेते हैं
Based on patient's HFA ICOS cardiovascular risk, what ECG surveillance would you advise? A. At baseline, B. At baseline and at completion of chemotherapy, C. At baseline every 3 months during treatment and 3 and 6 months post completing treatment. Option D. At baseline every 3 months during treatment and 3 to 12 months post completing treatment. Option E. At baseline every 2 months during treatment and 3 to 6 months post completing treatment.
And the timer is on your screen.
option delta
MIC, yes. So,
option delta option delta
so 15 seconds to go. Option delta.
man
You want me to lock D delta, right? Okay. Lock D
yes delta.
delta. Oh no, that's another miss. Well. So, question 5 goes a begging as well.
इनको बता देते हैं हमें बता हाँ नहीं क्या
Okay, MIC. You still have a chance. Don't worry. Let's see what the question 6 is. Question number
that
6.
risk assessment
Based on the patient's HFA ICOS cardiovascular risk, how would you advise echo based surveillance? No echo surveillance needed. B. At completion of chemotherapy. C. At baseline every 3 months during treatment and 3 and 6 months post completing treatment. Option D. At baseline every 3 months during treatment and 3 to 12 months post completing treatment. E. At baseline every 2 months during treatment and 3 and 6 months post completing treatment.
And the timer starts now. Panthers, we can't hear you.
option Charlie
Okay, are you sure? You've come down the wicket. You want to hit this one for a 6? Straight over long on. Let's see. C Charlie. Should I lock it?
yes option
Okay.
Charlie
Lock C Charlie. That's another miss. So with this, we are now left with 4 questions. And you have to answer them correctly to win it. All right. So can we have question number 7?
In which of the following chemotherapeutic agent ECG monitoring is class 1 indication for QTC prolongation? A. HER2 target therapies. B. Anthracyclines. C. VEGF inhibitors. D. BCRL ABL tyrokinase inhibitors. E. None of the above.
And the timer starts now.
One indication for QT.
HER2 ट्रांसटुज़ुमाब है, एंथ्रासाइक्लिन जो है ना, साइक्लोफॉस्फेमाइड्स वगैरह हैं, QT प्रोलॉन्गेशन में वेस्कुलर एंडोथेलियल ग्राफ्ट वो ट्रांसफर वो भी BCR ABL ट्रांसटायरोसिन काइनेज इनहिबिटर्स या हार्ट QT प्रोलॉन्गेशन रिदम डिस्टर्बेंस कौन से करते हैं QT प्रोलॉन्गेशन में? तो QT वो और हाइपोकैल्सीमिया के साथ कोई एसोसिएशन नहीं है। एंथ्रासाइक्लिन के साथ जाना चाहिए हमें। नो आई थिंक एंथ्रासाइक्लिन के साथ जाना चाहिए। QT से प्रोलॉन्गेशन का हमने कभी कीमो में नहीं पढ़ा वैसे, है ना? QT से प्रोलॉन्गेशन किसी ड्रग का नहीं पढ़ा हमने।
25 seconds.
बोलो मैडम बताएं। साइक्लोफॉस्फेमाइड है वो है
15.
एंथ्रासाइक्लिन नन ऑफ द अबव, none of the above
10 seconds. So option E, none of the above. E epsilon, right?
yes
Okay, lock E epsilon and let's see.
कोई तो सही हो जाए।
Oh, that's another miss. So another wrong answer, which is question number 7, and we are only left with 3 questions now. So can we have a draw if we answer them correctly? Come on, Panthers. Aga Khan has its tail up now. All right. Question 8 on your screen.
Regarding this patient, what should be the advice regarding chemotherapy as per 2021 ESC cardio-oncology guidelines? A. Do not administer trastuzumab. B. Consider dexamethasone. C. Continue trastuzumab. D. Continue trastuzumab with cardiovascular monitoring. E. None of the above.
And the timer is on your screen.
यार ड्रग्सुज़ुमाब जो होते हैं ना वो उसके साथ ऐड किए जाते हैं जो फर्स्ट लाइन कीमोथेरेपी हम स्टार्ट करते हैं, जैसे साइक्लोफॉस्फेमाइड है उनके साथ, और ट्रांसटुज़ुमाब तो उसके कंटिन्यू ट्रांसटुज़ुमाब विद रिस्क कार्डियोवास्कुलर रिस्क मॉनिटरिंग होती है, ये होना चाहिए। कंटिन्यू ट्रांसटुज़ुमाब तो है, उसको कंटिन्यू करना चाहिए। ट्रांसटुज़ुमाब को हमें कार्डियोवास्कुलर मॉनिटरिंग के साथ ही करना चाहिए। डेक्सामेथासोन रिस्क कम करता है कीमो का, लाइपोफोल परफ्यूजन हो या ये हो, इसके साथ हमें कंटिन्यू ट्रांसटुज़ुमाब विद कार्डियोवास्कुलर रिस्क मॉनिटरिंग होनी चाहिए। नहीं, कार्डियोवास्कुलर रिस्क मॉनिटरिंग के साथ करना चाहिए इसको। ऑप्शन डेल्टा क्या मैडम? नहीं, डोंट वाला नहीं है, ऑप्शन डेल्टा।
Okay, so you want me to lock D delta, right?
Yes.
Okay, let's see. Every question from here on is important and will be consequential. Lock D delta. Yes, that's very well played. I think the credit goes to the captain. He was spot on with his thinking. Very well done. Brilliant play here. Great. So with this, we now have 2 questions. This is the second last question. Question number 9 on your screen, please. Read the question.
The patient undergoes 1 cycle of chemo and then undergoes global longitudinal strain assessment to further assess the LV function, which is as shown below. What medication for to this patient? A. ACE inhibitors. B. Beta blockers. ACE inhibitors and beta blockers. E. ACE inhibitors and aspirin.
And there's a picture. Show the picture, please.
हाँ, ग्लोबल लॉन्गिट्यूडनल स्ट्रेन जो इन्होंने किया हुआ है उसके अंदर तो डेफिसिट है वाकई। ये वाला जो एंटीरियर है इसके सारे सवाल
60
वो हमारे हमें इसको बीटा ब्लॉकर भी देने चाहिए, इसको एस इनहिबिटर भी देना चाहिए। कितना इसका वो बताओ एलवी फंक्शन कितना असेस किया हुआ? काइंडली शो द पिक्चर प्लीज। कितने इसके 12 इसका दिया हुआ है, 10 उसका दिया हुआ है। इसको एस और बीटा ब्लॉकर दोनों होने चाहिए। इसको एलवी डिसफंक्शन हुआ हुआ है। कैन वी हैव द आंसर्स प्लीज? क्वेश्चन सॉरी,
show the answers, please.
AC inhibitors and beta blockers, D option delta.
Are you sure?
Yeah, LV is dysfunctioning, then both are appropriate to
so
give.
he really wants to heave it over extra cover. He's come down the wicket. He's still got time on his side. He wants me to lock D delta.
Option delta.
Okay.
AC inhibitors and beta blockers.
Lock D delta. Let's see. Yes, that's beautifully played. Once again, logical thinking, keeping your wits about. And I'm really enjoying, I think everybody's enjoying these last few questions. Very well done, MIC Panthers. Credit to you.
Hamza, the last question is going to be very, very interesting because they may come to a draw.
Exactly, sir. And this is what we all wanted. A nail biter. I think this pool is going to be still open. That's beautiful. So, question number 10, the last question of the match. On your screen. Read it, please.
Which of the following chemotherapeutic agents cause reversible cardiac dysfunction? A. Trastuzumab, B. Doxorubicin, C. Alkylating agents, D. Cyclophosphamide, E. Citarabine.
And the timer
That,
starts now.
and that is the answer is the trastuzumab, option alpha.
Wow. Are you sure?
Yeah, I'm sure.
He has made this one into a full toss and he's hitting. Is he hitting for a 6? We don't know. Ishaq Saab won't be happy. You are not taking your time. He wants us to log A alpha. Right? Okay.
Yeah, we want you to lock the option
Lock.
alpha. Trastuzumab reversible cardiac dysfunction cause करता है.
A alpha.
It's a type 2 cardiac dysfunction.
Lock it, please. And yes, very well done. Beautifully played. I think you were brilliant in these last 3 questions. Outstanding play. Very, I think, whoa, what a game. It's been a wonderful game and it's a draw. So we have now come to
Sir,
a draw.
I want to.
Yes.
It was a whole series of HFA ICOS risk. That was a first for us. We were not aware of that HFO ICOS risk, and we were expecting any other question other than HFO ICOS risk.
Yes, I know. We totally agree with that. And I think you've proven it. And the way you have deciphered it, leading from the front, and I think you've got those leadership skills, we can see that. I think you've led your team well. And credit goes to both the teams. I think Aga Khan Stars, you've done very well. MIC Panthers, you've done equally well. But what a beautiful game we've had. And this pool, this group is still open. It's wide open. So that's great to see. And I think in all my excitement, I'm going to turn towards Professor Ishaq. Sir, your thoughts?
Well, what a match. बिल्कुल वो पानीपत का मैदान था आज तो बड़ी You see, I am glad that those areas which we do not normally touch have been touched in this particular match today. The questions came to me very late last night for review. Unfortunately, they come earlier, and I realized I reported to to Hamza that both the questions are equally difficult because they've got a lot of figures, and whenever there are figures, the questions are going to be difficult. But the way both teams have attempted and tried their best, I must congratulate both of them. They have done very well. You see, these are difficult questions. And अब बात यह है कि कितनी गाइडलाइन पढ़ेंगे बच्चे बेचारे AHA की पढ़ेंगे ESC की पढ़ेंगे ACC की पढ़ेंगे अपनी पढ़ेंगे Asian पढ़ेंगे So I think guidelines has made life easy as well as difficult also. So I think those areas which we normally do not discuss have been discussed today. It was a learning experience not only for the trainees and fellows, for me as well, and I'm sure my other faculty colleagues will agree with me. And the match has ended up in a draw. It's a very interesting situation, and both the teams need to be equally complemented. And the way you really encourage them to come to a good answer is remarkable. And sometimes you're pushing them brings a very good result also. So I think you also need to be complimented for your excellent moderation. So I think as usual, I enjoyed it, but today I think some of the questions were a bit difficult and very challenging. And both the teams have faced the situation with courage and patience. And I must congratulate both of them. And I think this is our future of cardiology, which I think is very bright in the presence of these trainees, inshallah.
Thank you very much, sir. I think it's the guidance from you and mentors like you which actually keeps all of them going and all of us going. And you know, when I'm sitting here in the studio and I'm moderating the session, it seems to me as if I am part of the show, and I'm definitely part of the show, but I feel as if I am one of the competitors and I am also competing, and I enjoy it thoroughly. I think everyone is performing really well, and this one really highlights, although it was a low scoring game, low scoring match, but then the difficulty was equal. You're absolutely right. I think your assessment is spot on, and it has also reflected in the results. So this is, I think, also where the credit goes to our council members and the panel which sets these cases, and it's a beautiful effort all around. And I think we have Professor Amber Ashraf. We would like to have her input. Ma'am, your thoughts, your final thoughts.
Thank you very much. It's a wonderful match. No doubt, the main aim is education, learning, motivation, and that's what's, alhamdulillah, we are gaining from this series of activities. And I highly appreciate the hard efforts of our faculty, especially under the leadership of Professor Ishaq, Feroz Mehman Saab, and the rest of the Pakistan Cardiac Society team. Wilson and you all did a wonderful job for the PG's academic. And this is a Sadqa Jariya, basically, if we do understand these things. And these are very pertinent, important topics, so that we're upcoming cardiologists, they do understand these are all the part and parcel for that thing. Thank you very much. Ishaq Saab has already concluded the thing in a very nice way. Anyhow, congratulations to both the teams, because they reach here after such a long journey. And congratulations to their supervisors as well. And let's see how the matches in future will lead further. And thank you very much. I always appreciate your moderation. And thank you for giving me this honor and praising with such a nice words. Thank you, Wilson Pharma, as well. And thanks a lot, Chief.
Thank you very much, ma'am. It's you know, the pleasure is all ours to have all of you. I think we have our stars in the form of our faculty members. You people have done a wonderful job. I think all these students, and in fact the upcoming faculty, that also looks up to you, stalwarts of cardiology and medicine. I think this is where it all shines. And today, definitely Super League has shown really well. Our shining stars, the two teams, they really did well. They fought it well. And Aga Khan University Hospital stars, they put up a low total, I would say a reasonable total in the end, because it was a difficult pitch to bat on, to be honest. And then MIC Panthers, they came out, they thought it would be easy, but no, it wasn't. And in the end, it seemed as if there was a moment when I thought probably MIC is not going to make it. But then in the last three questions, the way they came back and the way they did it, so congratulations all around to both the teams. Very well done. The pool, the group is still open, and Pakistan Cardiac Super League is definitely coming of age. And with this, I think it's our time to go home excited and ecstatic, and you've made our day. Well done, teams, and we're looking forward to the next match, which is going to be the fourth match of the Super Sixes, and we look forward to having you again. It's always a pleasure for me to be a part of the show. Till then, I'm going to now sign out. Till then, Allah Hafiz. I'm signing out. Allah Hafiz then.